concentrated thyroid, 1 grain of that, and I put her on melatonin with theanine to help her with the sleep issues. Okay, now why oral E2? Now we all know that estradiol plays a very important role as far as the cardiovascular system is concerned. It has a protective effect, it enhances, it restores optimal endothelial function and enhances vascular function, promotes plaque stabilization, and has very potent antioxidant effect. Okay, the transdermal estradiol does not have this effect, so oral is preferable. Now, apart from that, the E2 decreases osteoporosis, improves cognitive function, decreases central adiposity, prevents urogenital atrophy, stress, urinary incontinence, etc., helps with dry eyes, cataract, tooth loss, saggy skin, everything that this woman practically suffered from. Now, it has been seen in studies, Finnish and Danish studies, that women who are menopausal before the age of 45 have a 7-time more risk of developing coronary artery disease. And those in whom BHRT is initiated have a 50% decrease in the risk of mortality from cardiovascular events and 35% decreased mortality from all other events. Okay? So, and women with PCOS have a higher risk of CVD. So all the more reason BHRT was very necessary in these women. Now, apart from that, let's look at what estradiol does to the brain. It triggers serotonin and the production of other neurotransmitters, all the other neurotransmitters. It increases, and I can't go into the details how it does it, but it increases serotonin production. It modulates dopamine synthesis. It enhances norepinephrine, low amounts of which can cause decreased energy and impaired focus. It supports acetylcholine production, which is essential for memory and learning. It modulates balance between the excitatory glutamate and the inhibitory GABA in the brain. Okay? And women with PCOD are more prone to have mood disorders, so all the more reason you need to give it to them. Next, I treated her with progesterone. Progesterone is a natural anti-anxiety and antidepressant. Okay? So I initially gave her a little higher dose, which I decreased. Cholesterol also progesterone also decreases cholesterol, it increases HDL, decreases plaque progression. It decreases hot flashes, night sweats, maintains the skin elasticity, maintains the uterine lining, the thinness of the uterine lining. And patients with breast cancer should be put on progesterone. Okay, progesterone also decreases the incidence of uterine and colon cancer. And as I said, it acts as a natural anti-anxiety and an antidepressant. It decreases panic attacks. And how does progesterone do that? It actually enhances the activity of the GABA receptors. Okay? And if you have less progesterone, then you have less GABA, and this leads to anxiety, insomnia, and increased stress. Progesterone also modulates increased serotonin levels, but not as much as estradiol. The Replenish study has shown that both estradiol and progesterone are safe against cancer. Okay, the next drug I put her on was DHEAs. DHEAs, as we all know, is very important in making testosterone and estradiol. As we age, there are 2 hormones which increase, insulin and cortisol. All the rest decrease. Okay, so as we age, as the cortisol increases, DHEA goes down. And DHEA is very important for the quality of our life. It acts as a lipolytic, and it decreases sugar, decreases insulin sensitivity, increases immunity, improves sexual function, increases muscle mass, decreases weight, decreases cholesterol, and contributes to energy and vitality. It also enhances mood by influencing the serotonin and the dopamine pathways. So if you have decreased DHEA, you're stressed, you're anxious, you're depressed, and you can't cope with life. That's exactly what this woman had. Okay? So the more DHEAs you have, the longer you live. Okay, I can see patients' levels and see how long just by looking at their DHEAs. Now, testosterone. Testosterone in women is a very important hormone, especially the ones who suffer from low libido. But testosterone is also important to decrease their fatigue and also improve their well-being. It helps reverse diabetes, decreases cholesterol levels, it reverses osteoporosis, improves bone density, increases skin thickness, collagen, and how does it act? It positively influences dopamine, which is critical for motivation, pleasure, and mood stabilization. And if you have low levels of DHEA, you tend to have low energy, low confidence, apathy, which is exactly what she had. And it supports, it increases sexual desire and arousal, and also supports mental clarity and focus. Okay, so women who have, all right, I'll just talk to you about this. Yeah, I'm just going to say it at the end, okay? I'll just quickly tell you why I gave her what. Then I gave her T3, which is very, very important, because T3 regulates metabolic processes that provide energy to our brain cells and to the rest of our body. If you have decreased T3, then you know all the symptoms, right? Cold, intolerance, dry skin, weight gain, constipation, muscle weakness, and joint pain. So balance is very important for emotional well-being, energy, motivation, and quality of life. We don't look at T3 like that, but T3 is very important for all these things as well. It helps maintain a stable brain function. And less T3 can cause you to decrease decreased concentration, decreased memory, a decrease in problem-solving capabilities, irritability, depression, and you basically can't cope with stress also if you have low T3. Okay? Now, it also plays a crucial role in regulating the brain neurotransmitters. It is essential for maintaining optimal levels of serotonin, dopamine, and norepinephrine. And if you have low T3, you can have symptoms of persistent sadness, which is exactly what she had, loss of interest in activities and feelings of hopelessness and worthlessness. So don't forget about T3, because it influences the brain stressor response by modulating the cortisol levels. Decreased T3 can lead to increased cortisol sensitivity, which again gives rise to anxiety and restlessness. So after 2 months, I checked all her hormones, they had increased. She was feeling better. I lowered the dose of progesterone slightly because I put her on a higher dose. And then in conjunction with her psychiatrist, I slowly started decreasing her antidepressants, half a tablet continued for a month. So over a period of about 7 months, we were able to take her off her antidepressants and take her off her anti-anxiety was the last to go, left her just on melatonin, and now after 2.5 years, she still is on the hormones. All of her parameters have improved. Of course, I don't say it's only the hormones that have improved her. Lifestyle modification is very important. Supplements are very important. Your minerals are very important. So are your vitamins. And of course, the 4 hormones that I gave her. Thank you.
I think the best thing what you mentioned in the between, in fact, the only 2 hormones which goes up with age. I think all the students or juniors should understand that it's only the insulin and cortisol which goes up, whereas all other hormones they keep dropping. So if you understand this, and bioidentical hormones are a real good thing because of her presence, Sunita's as Ali Mama, Ali was such an instrumental. We never thought we were actually got into this, and we were all, so Vijay, you must have seen Alina. No, you are not there. You came quite late into the picture. Okay? But whatever is it, it was great actually to be a part. Sudha is smiling from there. I did not take much time here. And Dr. Aarti, yeah.
What Dr. Digambar said, that you are exactly what you eat, you exercise, and what you think. I would like to add you are your hormones. Okay, I know it goes indirectly, but it's so important. If I look at all the people here, all of us, okay, look at our little bellies. We know we're low on testosterone. All the men are low on testosterone, okay, if you have a low belly. So we don't give enough importance to this. And if you really want to be happy, then we need to balance out. Thank you.
Thank you.